Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about why it feels like your leg is longer after having knee replacement surgery. Hey everyone, so today we're talking about your leg length. And in particular, we're talking about why after surgery, for a lot of people, does it feel like your leg is longer? So the leg that you had surgery on feels longer. And we'll talk about why this might be, and we'll talk about what we can do about it. So there's probably three main reasons, I think, why it may feel like, and it may be the case, that your leg is longer after having a knee replacement. So the first reason is with osteoarthritis, the space in your knee joint is decreasing. So the space and the volume within your knee joint is decreasing. So if you think of a nice healthy knee, there's that space, that spacing between your thigh bone, your femur, and your shin bone of your tibia. There's that space where the fluid is and your cartilage is, and it is a normal healthy knee. When you have arthritis, there's breakdown of that cartilage, there's decrease in the fluid, and there's decreasing of that joint space. So narrowing joint space, you might have heard of that if you've had x-rays of your knee before possibly. And it's basically is that healthy space and that healthy fluid is decreasing potentially to the point where you might have what's called bone on bone. And that's where the arthritis has progressed so much and that joint space has narrowed so much that it's essentially the bones are on top of each other when you're moving and doing things. And so when you have knee replacement surgery, your surgeon is going to try the best they can to restore that normal spacing and that normal volume of your knee joint. So that you're going to take a knee that was narrow space and decreased space, and now you're increasing that space back to a normal healthy knee, or at least as close as we can get to it. So you're taking this narrow space and you're increasing that volume, and by increasing that volume of the knee joint, in turn that's going to increase the length of the knee a tiny bit. The second reason is a lot of folks who have knee pain and arthritis are going to have some deformities of the knee. So they're not going to have a normal healthy alignment of the knee. You could have significant knock knees where the knees are caving inward toward the middle, or we call this a valgus deformity. Or you can have a bow-legged deformity where the knees are bending out laterally, and this we call a varus deformity. And in both instances, when you go to have knee replacement surgery, again, your surgeon is going to try their best to correct this deformity and improve the alignment of your knee so you have a better alignment and a healthier knee joint. And so by taking something that is bent either toward the middle of your body with the bow-legged or outward with I said that backward, either toward the middle with the knock knee or outward with the bow-legged, something that's bent, and they're going to improve that alignment so it's going to become straighter. So going from bent to hopefully straighter, a little better alignment is going to again increase that length of your leg. The third reason is more of a perceptual reason. So your brain and your mind and your nervous system are what kind of keeps track of the mental map and the mental picture of your body and where your body parts are in space, where your arms are and where your shoulders are and your legs and your feet and everything. And what happens is with things like knee pain and arthritis, or after knee replacement surgery, you have a lot of pain, swelling, stiffness, other symptoms going on. And when you have those symptoms for a really, really long time, what happens is it starts to distort the perceptions that your mind and your central nervous system and your brain has about your body. So for example, people who talk about, I feel like my back's out of place, I feel like my SI joint's out of place, or my shoulders out of socket. It might not necessarily be the case. It might just be that perception is a little mixed up because of the chronic pain, swelling, and other things that are going on in your body. So an analogy to think about is if you have a nice map, a paper map of somewhere, and it's nice and it's clear, easy to read, easy to understand. That's your brain and your central nervous system normally when you're healthy and don't have any chronic pain or anything like that. Now, if you have chronic pain or you've just had your post-op from knee surgery or you have other symptoms, swelling, stiffness, all these things, it's almost like someone spilled a cup of coffee across that map, and now it's all muddied, it's all hard to understand and hard to picture what's going on. And that's what happens with your mind and your brain after having pain for so long or having a significant event such as a knee replacement surgery. So those three reasons are why it is potentially true that either the knee is possibly longer than it was, or it might feel like it's longer than it was before surgery, is because you're increasing the volume and this joint space within the knee joint. You're correcting any of that bow-legged or knock-knee deformity of the leg, and your mental perception of your body after surgery because of all the pain is a little muddied and a little unclear. So what can we do about it? Well, one thing you can do is just give it time. Let your body, get used to being how it is now. Possibly prior to having arthritis and all these things going on, you at one point had a normal, healthy knee joint with the normal spacing and maybe not as significant of the knock knee or the bow-legged deformity. So it might just be your body, your legs, your muscles, your tendons, everything just needs time to get used to the new stresses, the new forces that are being applied to it, and just getting comfortable moving again. And this may take a number of weeks, it may take months, it may take even longer for that to happen. But in a lot of cases, just giving it time, just moving, just getting used to how your leg and how your body is now after surgery can lead to improvements and a decrease in this symptom or feeling that your leg is weird or too long or anything like that. Now, if there is significant difference in the length of your legs after surgery, you can get orthotics, so you can get a heel lift, so a simple little thing that goes inside your shoe and lifts up your heel to help kind of adjust that height. So that would go obviously on the leg that feels shorter, so that's probably the non-surgical leg in most instances. So you can get a heel lift. You can also get other shoe lifts, so you can get shoes with the midsoles that are increased thickness, and so again, trying to correct that difference if it's significant enough where it's really affecting your your ability to do things, your pain levels, whatever it may be. So there's those options. And the other option that you might want to consider, or you might want to talk with your physical therapist or consult with your surgeon about, is the potential that you want to take a look at that other leg. So a lot of people, it's common to have arthritis in both legs, maybe to different extents, but if you have arthritis and maybe some deformities in both knees, and you have surgery on one leg, and the surgeon corrects, increases the volume, increases that spacing, corrects some of the alignment, it might feel awkward and might feel off until you address the other side and do that same thing and correct the joint spacing and the alignment of the other leg. You're just doing one side and then the other side still has this deformity. It might feel awkward moving that way. So that's something worth consulting with your surgeon, consulting with your physical therapist to address this sensation and this perception of the legs being different lengths after your knee replacement surgery. Hope this was something helpful. Please, 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 if you don't already, subscribe, hit that notification button so you're notified every time I post new videos. Be sure to check out all our other videos and great content we have. And thank you very much for watching.